Assalamu alaikum नादरीन, I am Dr. Mansoor Ahmed Buzdar. This is the case of VKC vernal keratoconjunctivitis. This is a seasonal allergy, and in this case of this child, this case is severe, and you can see the signs and symptoms in the eye of the child. Beta niche dekhe. Very good. You can see in the eyes of the child there are severe signs and symptoms. There is also watering in the eyes of the child. What are the causes? It is a disease of seasonal disease. This disease affects the child mostly in summer season, and there is also there are also chances of keratoconus development in the case of this vernal keratoconjunctivitis, and there is signs and symptoms are severe itching, watering, burning, and especially at the evening time when patient try to sleep, patient complains of about severe pain and itching. This is the disease mostly developed in the child of and patient of adolescent age. This is also can develop because of unhygienic conditions. We can prescribe antihistamines and antihistamine antibiotics in the moderate cases, but in case of severe VKC, we can prescribe corticosteroids to decrease the inflammation. Cold compresses also we will prescribe to for comfort of patient. In case of a student or any worker who work at sunny areas, we will also tell them to use sunglasses. Thank you so much.